Hello everyone, welcome back. Today we'll be studying asphyxia neonatorum or respiratory failure in newborn. So the inability of a neonate to initiate or maintain spontaneous respiration within 1 minute of birth, it corresponds to Iugr score of 3 or less at 1 minute. Okay, so basically what is the meaning of first line? That the neonate is not able to initiate or maintain spontaneous respiration within 1 minute of birth. Okay, and in Iugr score, what is the score is coming? That is 3 or less at 1 minute. So it is characterized by progressive hypoxia, hypercapnia, hypoperfusion and metabolic acidosis. So 4 characteristics will be present, that is progressive hypoxia, hypercapnia, hypoperfusion and metabolic acidosis. So what are the causes? Now see, intrauterine hypoxia and birth trauma. So in both cases this happen. Okay, now coming to the clinical features. So what all are the clinical features now? According to the level of intensity of clinical feature or respiratory depression, condition classified as asphyxia livida, that is stage of cyanosis, Iugr score will be 4 to 6 and this is called mild respiratory depression. And next one is asphyxia pallida, okay? That is also called stage of shock. Iugr score is 0 to 3. So this is the more severe, right? Severe condition compared to asphyxia livida. Severe respiratory depression, that is weak and thready pulse, then pale skin, absence of reflexes along with difficulty into breathing. Now coming to the management. Babies with Iugr score 8 to 10, it will be no need to do anything. So this is actually a healthy baby. Okay. Now if Iugr score is between 5 to 7, then we have to start 100% free flow oxygen at 5 liter per minute. So this one we have to start. Then babies with Iugr score below 3 to 4. Okay, now again severe condition, that is give positive pressure ventilation with bag and mask ventilation for 30 seconds and again reassess. So first one was if Iugr score is between 8 to 10, then it is normal condition, so no need to do anything. If Iugr score is coming to 5 to 7, then give 100% free flow oxygen at 5 liter per minute. And now again if it is 3 to 4, if it is coming, then give positive pressure ventilation with bag and mask for 30 seconds and again reassess. So up to this all is clear, I hope. Then coming to resuscitation of newborn. So let's see what all are the steps. So steps of resuscitation are TABC. In normal, if we assess in case of adult, it is A, B, C, D, E, F, G, H, like that, it will be continued. But in case of newborn, it is TABC. T for maintenance of temperature. Okay. So this is the single most important for circulatory assessment. This will be the temperature for newborn. Now coming to A for establishing an open airway. Then B is initiating breathing. C is maintain circulation. So these 4 steps for resuscitation are followed for newborn. Now initial steps of resuscitation. Dry up the neonate and keep under warmer, that is radiant heater. If you have seen in NICU or PICU, then you will be seeing that baby is kept under the warmer and after drying up immediately they are keeping the baby in warmer. Fine. Then position of the baby on back with slightly extended neck, 1 inch above the mattress. So basically this position is given so that the trachea or respiratory pipe or tract, it is positioned in one line. That's why slight extension of neck is done. Okay. Then suction, first mouth, then nose. Give suction pressure between 80 to 100 mm Hg or 100 to 130 centimeter of water. So basically they ask in question this 2 points in Viva also. Sometimes they may ask you that what is the suction pressure for newborn. Okay, so you have to remember in both, that is 80 to 100 mm Hg or you can tell 100 to 130 centimeter H2O. Okay, so these two you have to remember anyway because this is a 5-star question. Okay. Now give tactile stimulation to stimulate breathing by slapping or flipping sole of feet or by rubbing the back of infant. Okay, so what we are doing, we are giving tactile stimulation to the baby. Okay, where we are giving, that is slapping or flipping sole of the feet, or by rubbing the back of the infant. By this we are giving tactile stimulation. Now bag mask ventilation. See, indication, what is the indication? Poor respiratory efforts and heart rate below 100. And procedure is slightly extend baby's neck to ensure open airway. That I was telling now, that we are extending baby's neck so that the trachea and whole respiratory tract is one line, so that that baby can breathe. Okay, then start to ventilate by mask at the rate of 40 to 60 breath per minute. So this is a basically normal respiratory rate of a newborn, so we are maintaining that rate only. Then evaluate heart rate after giving ventilation with 100% oxygen for 30 seconds. Okay, then we are checking the heart rate, right, after giving ventilation. And what will be the oxygen percentage? That is 100% for 30 seconds. Then heart rate is above 100. Then what we will do? We will discontinue ventilation and monitor the heart rate, respiration, SpO2 and color of the baby. But if heart rate is 60 to 100, then we have to continue the ventilation. And if it is below 60, then what we have to do? Continue ventilation with 100% oxygen, and also we have to start CPR. Okay, so hope this is clear to all of you. Then coming to the procedure. What all are the procedure now? That is, first is thumb technique. That is preferable. Use both thumb, that is draw a line between nipples over sternum, or use lower half of the sternum. Okay, now 2-finger technique. Use of tip of the middle or index finger. Okay, so this 2-finger technique we have to use. So what are the procedure now? Explaining again, we have to use both thumb, draw a line between nipples over the sternum, or use lower half of the sternum. Basically in adult case we are compressing the lower half of the sternum. In case of newborn also same thing. Better if you draw a imaginary line between the nipples over the sternum, or you can also use lower half of the sternum. And what is 2-finger technique? That is use of tip of middle or index finger. Okay, now CPR. See, cardiopulmonary resuscitation. We will discuss in FON. Okay. Now coming to evaluation part. Check heart rate after 30 seconds of chest compression. Below 1 year, check brachial pulse, and above 1 year we can use same as adult, that is carotid pulse. Okay, then heart rate below 60, we will continue chest compression plus bag and mask ventilation and medication, that is adrenaline or epinephrine through IV or endotracheal route. Okay, then concentration will be 1:10,000. In question many times they trick you in exam. So you have to remember that if heart rate is below 60, we have to continue CPR plus BMV plus medication, that we can give adrenaline, epinephrine through IV or endotracheal route, and then the concentration will be 1:10,000. Okay, and if heart rate is 60 or above 60, then we have to discontinue chest compression and continue bag and mask ventilation. Okay, so that was the part of respiratory failure in newborn. So hope this point is clear. Now coming to preterm baby or prematurity. So what all are the features of preterm baby, or how we will assess the baby, and features or characteristics I am saying. Then what all are the complication and management. So all these points we will be covering from this topic. Okay, so baby born before 37 weeks, that is 259 days of gestation, and baby born between 20th to 37th week of pregnancy. First point is, that is baby born before 37 weeks, that is 259 days of gestation, and born between 20th to 37th week of pregnancy. Then categories are extremely preterm, that is less than 28th week, very preterm, that is 28 to 32 week, and moderate preterm, that is 32 to less than 37 week. Okay, now see assessment part. Assessment of gestational age of baby can be done by using New Ballard scale. It is a system for estimating newborn's gestational age by rating physical and neuromuscular characteristics of maturity. So basically by these 2 points, physical and neuromuscular characteristics of maturity, we are estimating the newborn's gestational age. Okay, and this scale can be used by neonate born between 20 to 28 weeks of gestation. Now it includes 6 neuromuscular markers such as posture, square window, that is degree of wrist flexion, then arm recoil, popliteal angle, that is degree of knee flexion, then scarf sign, what is that? Ability to extend infant's arm across the chest to opposite shoulder, okay? And heel to ear extension. Okay, so I am revising again. Then what are the 6 neuromuscular marker? That is posture, square window, degree of wrist flexion, then arm recoil, then popliteal angle, that is degree of knee flexion, then scarf sign, that is the ability to extend infant's arm across the chest to opposite, and heel to ear extension. Then 6 physical characteristics. What all are they? See, skin texture, lanugo, plantar creases, breast nodule, ear firmness and genitals. Okay? Then combined total score will be 0 to 29. Hope it is clear. Then the tool is most accurate if performed within first 12 to 20 hours of life. So we have to measure it within 12 to 20 hours of life if we want to get a accurate result. Now characteristics of preterm baby. See, weight is less than 2.5 kg and length is less than 44 centimeter. That is small in size. Okay, so this is the first point, that weight will be the 2.5 kg below, and then length will be less than 44 centimeter. That is small in size. Then crown heel length will be 47 centimeter or less. Then crown rump length, it will be 32 centimeter or less. Okay, then breast nodules less than 5 millimeter wide or may be absent. Okay, then absence of testis into scrotal sac, then undescended testis or cryptorchidism. So I am revising again, that is absence of testis into scrotal sac and undescended testis or cryptorchidism. Okay, labia majora widely separate in female baby. Labia minora and clitoris are exposed. Then nails are short and deep creases are absent in sole. Then ears are soft and flat due to absence of cartilage. Then scarf sign, that is premature infant's elbow crosses the body midline without resistance as the examiner draws the arrow across the chest to the opposite shoulder. That I was telling now. That's the scarf sign. What will be the? Basically, I am explaining you that if you try to cross the body midline, okay, body midline matlab kya hai? If you draw an imaginary line from your sternum, okay, that will be vertical line. Fine. Then what will be that? If you, what you are doing now, you will try to cross that midline with one arm to the opposite side of chest. Okay, that is the scarf sign. Then skin covered by abundant lanugo hair and little vernix caseosa. So what will be the point? That is skin covered by abundant lanugo hair and little vernix caseosa. Okay, now poor suck and swallow reflex and minimum flexion into extremities. So all these points will be seen in preterm baby. Now coming to the complication, that is retrolental fibroplasia, that is retinopathy of prematurity. That is high concentration of oxygen more than 40% cause vasoconstriction, which result in hypoxia. Hypoxia causes proliferation of blood vessels, then which make aqueous humor and vitreous humor turbid. Then hemorrhage and edema occur in retina, then which detach retina and ultimate cause blindness. Okay, so these all things will be the complication of a premature baby. Then again it is patent ductus arteriosus, we will be discussing in cardiology. Then hyaline disease membrane, then pathological jaundice. All these points also separately we will be discussing in upcoming session. Then management, see, clamp cord immediately to prevent hypovolemia. Then keep cord length that is 10 to 12 centimeter. Give less than 35% oxygen by mask or nasal catheter, because we are seeing now that if we are giving high concentration, that is more than 40%, it will cause vasoconstriction. So we have to give less oxygen, that is 35% oxygen by mask or nasal catheter. Then give 1 mg or 1 milligram if weight is more than 1000 gram, or 0.5 mg if weight less than 1000 gram. Vitamin K by intramuscular injection or in lateral aspect of middle third of the thigh, that is vastus lateralis muscles. Then give neonatal intensive care unit on NICU protocol. Then keep the baby in a warming device, example that is incubator, temperature 36 to 37 degree and 60% humidity. Give additional 20 to 30 ml per kg per day fluid in phototherapy and in radiant warmer. Now coming to post-term newborn or post-maturity. What is that? See, baby born after 42 weeks of gestation. What will be the causes? See, high standard of living with sedentary habits, elderly primigravida, that is age of 30 or above. So these will be the causes. Now coming to clinical manifestation. Let's see the points. Now, see, hypoglycemia, that is blood glucose less than 40 milligram per deciliter, and polycythemia. Now coming to parchment skin. What is that? That is atrophy of the skin with stretching, dry and cracked, without lanugo and vernix caseosa. Okay. मतलब क्या है, प्रीमेच्योर में हम lanugo and vernix caseosa is present, but in post-term that lanugo and vernix caseosa will not be there. Skin will be dry and cracked. Then also there will be present of atrophy of the skin with stretching. Then fingernails are long and extended over ends of fingers. Now wasting of subcutaneous fat and muscle in the extremities. Then increased risk of cold stress. This post-term baby will be in risk of cold stress because there has been wasting of subcutaneous fat and muscle in extremities. Okay. Dense heavy hairs on scalp. Then meconium expulsion and aspiration. Long and thin body. Meconium staining in nails and umbilical cord. ओके, बिकॉज पोस्ट टर्म बेबी का बहुत ज्यादा चांस होता है मेकोनियम एक्सपल्शन एंड एस्पिरेशन का. सो व्हाट विल बी द मैनेजमेंट नाउ? सी, प्रोवाइड नॉर्मल न्यूबॉर्न केयर, मॉनिटर फॉर हाइपोग्लाइसेमिया एंड मेकोनियम एस्पिरेशन, मेंटेन न्यूबॉर्न्स टेम्परेचर. वी हैव टू डू ऑल दिस थिंग्स. नाउ कमिंग टू intrauterine growth retardation or small for death or chronic placental insufficiency. See, babies whose birth weight is below the 10th percentile of the average of for the gestational age. Causes क्या है? Causes may be maternal, placental and fetal factors. So let's see one by one what will be the mother's factors first. That is malnutrition, anemia, alcohol, smoking and substance abuse. If mother is having malnutrition, if she is anemic, if she is taking alcohol or smoking habits, then substance abuse, all these points can be a risk factor. Then toxemia of pregnancy, that is gestational hypertension. Then young or old mother, that is below 20 or above 40 years. So if mother is below 20 years also or above 40 years also, in both case there is a chance of Iugr or intrauterine growth retardation. Then see, here also low blood oxygen, poor weight gain, short stature of mother, then multiple gestation of grand multiparity. Okay, if mother is multipara, मतलब क्या है? मतलब more than 3 child. Then short stature mother, उनका पेल्विस का स्ट्रक्चर भी थोड़ा अलग होता है, उनका सब कुछ इंटरनल ऑर्गन भी शॉर्ट में होता है, मतलब insufficient space. That's why that growth retardation can happen. Okay, now placental factor, what is? See, placenta previa or abruptio, etc. Okay, fetal factor, that is genetic or chromosomal abnormalities. Then types, that is symmetrical or hypoplastic small for dead babies, that is 20%. A generalized proportional reduction in the size of all structures and organs. Then fetus affected very early in the phase of cellular hyperplasia. Then come to asymmetrical, that is 80%. Then what is that? Here disproportional reduction in size and structure. First one was generalized proportional reduction in size of all structure and organ. Okay, now fetus, here fetus affected in later months during the phase of cellular hypertrophy. First one was because of cellular hyperplasia, and that is very early in the phase of pregnancy. And but asymmetrical, that is later month. Okay, and because of cellular hypertrophy. If you compare, then only you will understand better. So you also study by comparing two different points. Ponderal index, what is that? Used to identify symmetrical or asymmetrical intrauterine growth retardation. See, ponderal index, that is weight in gram and length in centimeter cube into 100. So if ponderal index is less than 2, that is asymmetrical Iugr. If ponderal index is more than 2, that is symmetrical Iugr. It is clear? So this formula also you can remember, that is weight in gram divided by length in centimeter cube into 100. So physical, now coming to physical feature at birth. That is deficit weight, birth weight 600 gram below the minimum in percentile standard. Length unaffected. Okay. So physical feature में क्या होगा? Length will not be affected, but birth weight will be deficit, that is 600 below the minimum in percentile standard. Then inappropriate thermoregulation, so those babies will not have in proper thermoregulation. Then head circumference is relatively larger than the body. Then hypoglycemia and hypocalcemia also will be seen in the baby. Old man's look, okay, this will be the look of a baby because that skin will be wrinkled like that, so that baby will look like old man. Then signs of polycythemia, example ruddy appearance, then cyanosis, jaundice, etc. Then signs of meconium aspiration. Now coming to feature during pregnancy. See, abnormal fetal growth usually noted during the second trimester. Then fundal height is less than expected for the number of gestational weeks. Now coming to management part, what all are they? Administered betamethasone 2 dose at 18-hour interval for lung maturity and surfactant synthesis. Okay, if premature labor is indicated. Okay. So what we have to do? We have to administer betamethasone, that will be 2 doses in 18-hour interval for lung maturity, because in premature baby that lung maturity cannot, if it is not happening, then there is a greater risk of respiratory depression. That's why we are administering betamethasone. Then best to perform episiotomy to prevent intracranial birth injury. Then prevent hypothermia. Advised to admit at secondary level newborn unit if birth weight is 1500 to 1800 gram, or to tertiary level newborn care unit. If weightless less than 1500 gram, treat at home. If birth weight more than 1800 gram. Okay, so we are advising to admit in secondary level hospital if birth weight is 1500 to 1800 gram, and if it is less than 1500 gram, then we are referring to tertiary level of care. But we can treat baby at home if birth weight is more than 1800 gram. So now come to large for gestational age, that is a newborn whose birth weight is above 90th percentile in the intrauterine growth curve. Then clinical features are birth trauma, respiratory distress and hypoglycemia. Okay, now monitor for signs of hypoglycemia during the first 24 hours after birth and initiate early feeding. ओके सो लार्ज फॉर जेस्टेशनल एज में ज्यादा कुछ नहीं है. हैव टू असेस दैट ए न्यूबॉर्न हुज बर्थ वेट इज अबव 19th percentile on the intrauterine growth curve. Clinical features are birth trauma, respiratory distress, and hypoglycemia. Then we have to monitor for signs of hypoglycemia during the first 24 hours after birth. And we have to initiate early feeding. Hope all these points are clear to all of you. See you in next session. Thank you.